Hey guys, welcome back to my channel. So we're getting super close to surgery now. At this point, we're only about like 4 or 5 days away, I think. So today I'm going to talk to you guys kind of about what Dr. Kashyap had told me at my in-person consultation. So it'll be a part 2 for that video. If you are new to my channel, make sure you subscribe and go back and watch part 1 so this all flows and makes sense to y'all. Okay, and disclaimer, you guys get to look at my natural wild frizzy hair for today because I'm getting braids in a couple of days and I don't feel like putting any heat on it right now beforehand. So let's get into it. I'm going to be reading a bunch off my notes and kind of off my phone as well. So just bear with me if I'm looking down a ton. So I didn't have a ton of questions for Dr. Kashyap when I had gone in, but I wanted him to see me in person so that I could make sure just with my mental that I was a good candidate for surgery and that I would have enough of a body type to get good results off of, because I am rather tiny to begin with. So right away, that was what I asked him, like, what do you think? Like, do you think I'm too small, or do you think I'll be a good candidate for it? And he had me stand up and he examined me, and then he kind of pinched the fat on the side of my stomach, and he was like, yes, he's like, we can definitely give you good results. Like, you're gonna be more than fine, which is exactly what I wanted to hear, considering my stomach was my major problem area from basically sitting in a desk, working in an office job for 2 years and eating nonstop. So the fact that he is going to be able to move that solidly into my butt was a really good relief. And then as far as result expectations, we didn't talk exactly about what shape I wanted or anything. We talked more about was he going to be able to do a good job with me. I didn't want to go into this being unrealistic and expect results that just weren't going to be achievable with my current body, but he assured me they'll be able to snatch me again, which is really just what I needed to hear in person, because one thing is them seeing your pictures online and approving you for surgery, but another thing is going in and meeting the doctor beforehand. So that just helps a ton, and it definitely takes a lot of the pressure off, I think, and just really eases your mind. Okay, and then another major thing we talked about was gaining weight. So I asked him if he thought I should gain any more weight prior to surgery. At the time, I was about 128-ish and 5'4", and he did not want me to. He said that if I gain any more extra weight, purposely, it might go to undesired places like my arms and my face, which I feel like it kind of has a little bit. But since he said that, I haven't really tried to do anything all that drastic. I have just been eating like normal. As we get closer to surgery though, I don't know what it is, but I am so hungry all the time. So I've been eating a ton before surgery. So hopefully that all just sticks to me and then gets moved over to my butt as well. I ideally had wanted to be around 140, I feel like, because a lot of his patients that are around my height are usually around that weight, 136, 140, and they come out super snatched. So right now I'm weighing in at 129, 130, still 5'4", so I'm hoping that's enough to make a good enough drastic result for me. The other major thing we talked about was vitamins. So on SX pages and just online and on YouTube, you see a ton of different conflicting ideas on what vitamins you're supposed to be taking pre-op and how long and how many, and it was just getting super confusing. And I was going off the sheet that Mia had given me for the dietary supplements, but I still wasn't sure exactly what to take. And he basically told me that in his opinion, they're all kind of a myth. You really don't have to take all that many extra things. And he talked about feeding the fat. He said that was pretty much a myth. He didn't want me doing anything extra besides what I was already doing. And he said, just be normal before surgery. His major thing was absolutely no smoking, no vaping, none of that. If there's anything I do, do not do that before surgery. But vitamins, he just really wasn't pushing any of them. And he said after surgery, like the feeding the fat thing, he thinks is a myth, but he told me to just eat normally to replenish all the energy and everything you just lost going through surgery. Since Dr. Kashyap didn't suggest for me to take anything totally crazy for vitamins or anything like that, I'm going to show you guys my vitamin haul and what I took all the way up until 2 weeks pre-op. Okay, so we're gonna jump straight into the vitamin haul. Again, I'm gonna be looking down. I'll let y'all know where I got the products from and the prices, and some of them like have info on the bottles, but I'm not gonna tell y'all what to take or how many to take. I'll just kind of let you guys know what I did, and you guys can go based off of what you think your body needs. To start, I was taking one of these a day. They're folic acid gummies. I got them off of Amazon. These were $16.55 on Amazon, and they tasted good. They were recommended, I think they were on the Mia packet as well, and I just saw them recommended on a lot of SX pages as well. So I took these for about a month, and then I took one a day and stopped 2 weeks before surgery. The next thing I took was the Hemoplex. These smell and taste disgusting. Honestly, they smell worse than they taste. The taste kind of goes away really quick. I took one of these a day for a month and stopped 2 weeks before pre-op as well. And these ones I got off of Amazon for $9.56. I know that people were talking about taking like Floridix or something, like other types of blood boosters as well. I didn't take any liquids or anything. This was all I took. Also, I didn't start any vitamins until after I took my labs, and all my labs came back completely normal off the bat. So I wasn't really using them to build up on anything. I was just kind of using them for added support. The next thing I took was vitamin D3. They're super tiny little soft gels. I've been taking these for a while, honestly. I don't know exactly what they do, but I've been taking them for a while, one a day. Got them at Target for $7.89, and I took these one a day for a month and stopped 2 weeks pre-op as well. The next thing I was taking were just regular adult multivitamins. I took 2 a day. I take these all year long, but I stopped these 2 weeks before surgery as well. And these are like from Target. These were from Target, and they're $9.89 as well. And then the last thing I was taking was a vitamin C. I feel like these help just with general immune support. They help me not get sick, knock on wood. And these are also from Target. I haven't seen the 375 counts sold in a while though. I know they're 100 counts, like $3, so I don't remember exactly what I paid for these, but I took one a day and also stopped these 2 weeks pre-op. Okay, and then the last thing I got in regards to my vitamin haul was this cute little organizer. I got it on Amazon a while back once I knew I was having surgery, and it was $7.99, and it just helped me keep everything organized so I could take these daily. Okay, so that is all for today's part 2 of my in-person consultation with Dr. Kashyap at Mia Aesthetics, and then my vitamin haul. So make sure to subscribe and leave a like for me, and comment if you have any other questions or want to see anything else. And stay tuned because next we will be setting up my bed for post-op.